My name is Hadley Bickford, and my presentation and paper were on an article that was titled Effects of Early Exercise on Metacarpophalangeal Joints in Horses. So just to give you a background on the metacarpophalangeal joint, this is more commonly known as the fetlock joint, and I'll sometimes refer to it as the MCP joint. It's located between the long pastern, or P1, and the metacarpal bone. This joint allows for flexion and extension, but has minimal rotating abilities. It's commonly incorrectly referred to as the horse's ankle joint. Instead, it's more like a knuckle in the human. This is a diagram of the lower leg in the horse. You can really clearly see all the bones as well as some ligaments and tendons. And the best part is that you can really clearly see where all the joints are. The arrow is pointing to the metacarpophalangeal joint, so just keep that in mind as we're going through the rest of the presentation. This is a quote that I found from Larry Bramlage. He says, "The fetlock joint is the joint that makes a horse a horse." Basically, he's saying that not only is the fetlock joint a joint, it also acts as a shock absorber, an energy storage system, and a stabilizer of the distal limb. To understand the joint a little better, the joint includes two mirroring sesamoid bones covered by flexor tendons and strengthened by numerous ligaments. Maximal flexion allows the joint to almost touch the ground. So when you see a horse in slow motion, you can see that the MCP joint almost touches the ground. Joint stress is a normal part of exercise, but can become more serious if combined with poor conformation and/or lack of fitness. I have listed a couple common issues and injuries specifically to the fetlock joint just to get a better idea of what can go wrong. Wind galls or wind puffs are the swelling of the joint pouch with synovial fluid. There's usually no lameness, but they're pretty persistent, so when you drain them, most of the time they come back. Infections in the fetlock joint are also really common. This happens when a foreign material enters the sterile joint capsule. The horse will experience extreme swelling and pain. Degenerative joint disease or arthritis is caused by specific trauma or usually just general wear. When the cartilage wears away, most of the time by age, it causes increased friction between the joint surfaces. While there's multiple treatments such as injecting steroids into the joint capsule, there is no cure for arthritis. Sesamoiditis is the tearing of the ligaments in the fetlock due to a stress overload. Ocellates are the inflammation of the connective tissue that surrounds the joint, and this is accompanied by swelling and pain and is mostly treated by rest. Ring bone causes osteoarthritis and can also lead to the development of spurs. It results from an extreme strain on the tendons and ligaments surrounding the joint. Here are a couple pictures to give you a better idea of arthritis. The picture on the left is an x-ray, and you can see in the fetlock joint that the cartilage is starting to wear down, so the joint surfaces are touching. And the picture on the right is a more clear diagram of a healthy joint and an unhealthy joint. So in the picture on the left, you can see where the synovial fluid prevents the two bones from touching, where on the right, the cartilage starts to break down, and that will start to cause some pain for the horse. In the article, it focuses on a study done by the Global Equine Research Alliance. Researchers took 12 young thoroughbreds and kept 6 in a pasture and gave 6 an exercise regimen in addition to pasture time. They were all euthanized at 18 months, in order to evaluate the MCP joint for different factors to determine articular cartilage erosion, fragments, and overall wear. They were evaluated by a computer program that produced 3D images. The researchers hypothesized that horses that were exposed to exercise early in life would have superior articular cartilage and subchondral bone characteristics with fewer gross lesions, compared with horses that had not undergone in post-exercise. After they finished the study, the researchers concluded that exercise did not cause dramatic changes. There were more apparent lesions in the pasture group, but any of the effects that were seen were mild. The researchers concluded that the inclusion of exercise in young horses' routines did not damage any of the musculoskeletal tissues and was not harmful, but instead possibly mildly beneficial, due to the fact that there were fewer lesions and higher bone formation rates in the exercise group. This image is one that was featured in the article. It was figure 4, and it represents the frontal aspect of the third metacarpal bone. It's a density gradient, so you can see pretty clearly the amount of lesions in the joint. The significant groove in picture B shows severe decrease in density, as compared to a mild decrease in density in picture A. These are the sources for my pictures, the article, and supporting information. Thank you.